And we are live. Welcome, everyone, to the Melanin Initiative. I am Geraldine Floramon and one of your co hosts for the Melanin Initiative podcast. I'm joined today by Kimberly and Alicia. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking down things into language that you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking too much of your time. On today's episode, we'll be talking about stroke and heart attack. By the end of this episode, it's our goal that you'll be able to define stroke and heart attack, discuss the signs and symptoms of both stroke and heart attack, discuss the risk factors for developing both of these conditions, as well as discussing preventative measures.
So as you know, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988. So this is a very wonderful, bountiful topic we have today. Robust topic we have today: stroke and heart attack. So we're gonna dive right on in. Kimberly, why don't you hit us up with a definition of stroke here?
Okay, so when we're talking about stroke, excuse me, we're typically talking about your brain and the blood vessels and blood flow that's going to that part of your brain. So it can involve anything from the neck up. And your stroke can happen by two things. Either you have a complete blockage, which we call an ischemic stroke. So instead of blood continuing to flow, there's something that's getting in the way, typically a blood clot. Or you can have that blood vessel completely open up, what we call a hemorrhage. More people have the first one where there's a blood clot, and that one we have a lot of treatment options and people have pretty good outcomes if treated in an appropriate time. The hemorrhagic stroke, where the blood vessel opens up, just completely opens up. Still, we have treatment options and people have still survived. It's just a lot more severe of a situation. You really do have to seek attention really quickly. And once you get there, they have to address you very rapidly. You need to be able to express what your symptoms are really fast because time is of the essence, which we're going to get into.
Correct. So the big question of the hour is, what are the signs and symptoms of a stroke? How do you know if you're having one? What does it mean? What does that look like? Well, what do you know? There's an acronym to help you remember the signs and symptoms of a stroke, and it is called the BFAST acronym. So we're going to run through each letter. So B stands for balance, right? The way you could assess this or figure this out, or maybe someone will be assessing you, is to ask the person if they've experienced balance, dizziness, or a sudden severe headache, right? So remember that. B, balance. What does the E stand for, Geraldine?
The E stands for eye. So it's a sudden loss of vision in one or both of your eyes, or double vision occurs. So if there's any issues with your vision, that is one of the telltale signs.
Kimberly, what's the F stand for?
F stands for facial droop. So like I said, when there's that clot or the blood vessel opens completely, blood is no longer flowing to your brain, and your brain is responsible for a lot of functions. We had the balance and coordination, ability to walk. We had the eye vision, and now we have F for face. And so blood is no longer getting to a part of your face or both sides. And so it's paralyzed. And what you'll notice is that part of the face isn't moving. And typically, when you look at that person head on, you can see that one side of their face is lower than the other. That's what we mean by droop.
Yeah.
And they might be difficult. Well, I don't want to get ahead of myself.
It's something that you'll a telltale sign is that if they smile, their smile might be lopsided. Mm-hmm. And that is an indication that they may possibly be having a stroke.
Absolutely. So the next letter is A, and that stands for arms. So similarly to what Kimberly just explained, just like the face could droop, your arms could also one work and not the other one not work as well. So the way you could test this is to ask the person to raise both arms. And simply, you may notice that one goes up and the other one may be slumped or doesn't move at all, or it doesn't have the same strength as the other one. That's what you're looking for. Is the strength equal? Does one arm drift downward?
Same with grip.
Same
Yeah.
with grip, exactly.
And we do that with the legs and feet too.
Absolutely. And what does the S stand for?
The S is for speech. So you might notice that if someone is having a stroke, they may have difficulty speaking, and the words may make sense in their head, but when they're actually expressing it, it does not make sense to us. And that is definitely an indication that they are having some type of event in their head, such as stroke.
Absolutely. And then Kimberly, what does the T stand for?
Oh, time. So time is of the essence, right? Because I just told you blood is not getting to your brain, all of your brain. And every second that goes by, those tissues are dying. And in most cases, we cannot bring those back.
And if you are the loved one watching someone or you're suspecting that they are having a stroke, call 911 immediately.
Mhm.
As we say in the healthcare world, time is brain. So the longer that we are having these stroke symptoms and we are not getting treatment, the harder it is going to be to recover back to your baseline or be that person that you were prior to having the stroke. So time is of the essence. We can't stress that enough.
And there goes the be fast.
Right.
Be fast. Right? So it has that double entendre.
Exactly.
I think I can say that here. Yeah. And so I've had so many patients tell me, my husband went out to mow the grass. He came back and he sat down and half his body was off the chair. I called my son. I told him what was wrong. He hung up. He called 911. Look at all the time that passed. How long did it take for him to walk into the house? How long did it take for her to see him? How long did it take for her to figure out something's not right here? How long did it take for her to get the phone? How long did it take for the son to pick up the phone? How long did he have to say, wait, what's happening? What happened?
Yeah.
How is dad? And then hang up and then call 911 and then have to relay the information to someone and say, well, I'm not there. My mom called, and then they relay the message to 911. Look at all the time that has passed. And so what I always tell people is call 911 first, then call your family, because your family can't help you.
Right.
Even if they're the ones that's going to pick you up, they have to stop everything they're doing, get someone else to take over, and then they're going to come and get you. By the time that happened, the ambulance could have been at your house.
Yeah.
And, in the hospital setting, a stroke is taken very seriously and we act very quickly. So, and I'm sure all facilities, but certainly the ones that we've worked in, there are, we call them stroke codes. So that can happen in the emergency department. They can call the stroke code on you. And when you get into the inpatient setting, we will also call the stroke code on you, because once again, time is brain. So we need to get all of the people involved that need to see you and treat you and
Get you
assess you.
imaging.
We got to get you your CT and a CAT scan and all the things that we need to get done immediately so we can save that brain.
Ooh, I'm glad you brought up the people, because we've been kind of doing a thing. We're talking about all the people who are involved in your care. So when we're talking about brain, we're talking about neurology. You're going to see a neurologist. That's a physician. If they think you might need surgery, you're going to see a neurosurgeon. Correct. When you get to the hospital setting, if it's critical like that, you're going to the ICU, where they have neuro ICUs. Actually, I started in the neuro ICU at that stroke center. And so those nurses are going to take care of you there. Then once you get stepped down, you go to a neuro step down. And then you mentioned time. So when we do our training, there's a certain time frame. Everything needs to happen from the second you call to the second you hit the door to the second you get that scanning of your head. So maybe you have been in the emergency department waiting for 6 hours because your stomach's hurting, but a stroke walks in, they're going to be first. So when we say, oh, we thought something was going to happen, but now it needs to change, that's because other things are happening with other patients that are more critical.
Yeah.
Especially when it comes to imaging, like your CAT scan and your MRI.
Absolutely. So let's talk about what can we do to make sure we don't have a stroke, and what puts us at risk for getting a stroke?
Right. So risk factors for stroke, there are controllable, which are modifiable risk factors, and there's also non-modifiable, which are things that are out of our control. As far as controllable or modifiable risk factors for stroke, they include smoking. So it's very, very important that you quit. That's like a huge thing in primary care, trying to get everyone to quit smoking. Also, your diet plays a huge role. High blood pressure. If you have a history of high blood pressure, it does increase your risk of having a stroke. Diabetes, as well as like high cholesterol and having a coronary artery disease or peripheral artery disease. Sickle cell disease can also increase your risk of a stroke only because of the way that the blood vessels are shaped. They are sickle. They can occlude that blood vessel in your, or when I say occlude, it means block. Sorry, it can block the blood vessels that are in your brain, which can cause a stroke. So oftentimes we don't think of sickle cell being a risk factor, but it's one of the huge risk factors. And I know, I don't personally know someone, but I know a friend of a friend who died, unfortunately, from a stroke because of that. So those are the controllable risk factors. As far as the non-modifiable or things that are out of our control, these include age. The risk for stroke increases with age, and the risk doubles every 10 years for those that are 55 years and older. However, not only older people have strokes, adolescents and young adults are also susceptible to stroke. As I just mentioned, the young lady with sickle cell was in her probably 20s or early 30s, and she had a stroke due to that. Gender is also a non-modifiable risk factor. Women are more likely to die from stroke than men. Pregnancy and use of birth controls and hormone replacement pills, which is a huge thing. A lot of women are on birth control or hormone replacement. It can put you at risk for stroke. That doesn't mean you can't use those things, but it's definitely important to know that it is a risk factor. So you want to be sure that you're on the lookout for those signs and symptoms. Race is another risk factor. African Americans are at a higher risk for stroke compared to Caucasians, and they are also at a higher risk from dying from strokes. Hispanic populations are also seeing a rise in death due to stroke. Family history is another risk factor. If you are a first-degree relative, meaning you have a parent or a sibling that has had a stroke, it increases your risk. And then having a previous stroke having a stroke prior increases your risk to having another one, as well as a transient ischemic attack, which is often termed as TIA, which is the acronym. And it's usually referred to as like a mini stroke. So you might have some of those symptoms that we kind of mentioned earlier in the BFAST, but they might be a little bit milder or they might not last as long, but definitely still important to get in and be seen. And then heart attack is another risk factor for stroke.
Yeah, for that TIA, the transient attack, the mini stroke, you also won't typically have long-lasting symptoms.
Right.
And so you might have those for a couple of years before we even get to something. And, it's obviously accumulated. I love how you talked about the controllable, especially the birth control one. That might need to be a special topic, birth control, because let's say you're on birth control. She said, it's important just to know that information. So if you're on birth control and you smoke, you've just doubled your risk, right? Because we know birth control is an important tool in our toolbox for a number of reasons. And so if you're going to do one, which really you shouldn't do the other, it's very important to know that. And then when she talked about all those controllable ones, they all affect circulation, which is what we highlighted in the beginning.
So what can you do to prevent having a stroke? Well, all those risk factors, there's like a way to prevent the risk factor, right? So eating healthy foods and drinks, right? So making sure you're having those foods low sodium, high protein and nutrients and all those good things. Maintaining a healthy weight and physical activity. Get out there, get exercise. Don't smoke. Now, I'm not saying limiting smoking. I said don't smoke. And then limiting your alcohol intake.
That's all smoke. That's cigarettes, cigars, hookah, all of it. Secondhand smoke,
right?
Just as important.
Absolutely. Checking your cholesterol.
Yeah, a lot of this really has to do with fat in the diet.
Exactly.
That's like actually the big thing with all those foods. Yeah, because people who don't consume animal products that are high in saturated fat, their chance of ever having a heart attack is really, really slim because of that.
Making sure you maintain your blood pressure control and diabetes control, treating heart disease. And if we don't say it enough here on the Melanin Initiative, I'm going to say it to you again. Follow up with your primary care provider.
Absolutely.
Because they're going to be having these conversations with you early about maintaining your weight, having an active lifestyle. They're going to check that cholesterol. They're going to make sure your blood pressure is under control and that you have the diabetes management you should have if you have that. So following up with your primary care provider and listening to their advice is actually going to help prevent you having that stroke. And
they can refer you for a nutritionist too. If that's that's mostly, it's 80% nutrition anyway, because you can't outwork a bad diet.
Right. You can't outwork your family history, right? There are just some things that are inevitable. However, you have to do your part in maintaining to control those controllable risk factors, right?
And this episode's so timely because of this. 'Tis the season.
Oh yeah,
right? Where we're having
is.
those delicious work parties, holiday parties, right? And people. So what happens? We see people typically after, sometimes a little bit after Thanksgiving, picks up even more after Christmas,
Yeah.
and really after New Year's, because people have been in, they were living on the border already, and then the holiday just tips them over.
Yep.
And they come in and spend some time with us in January.
They do. New year, new me, but not the way you want it. So Kimberly, let's switch gears a little bit. Let's talk about heart attack.
Very closely related.
Yes.
Yep.
So how do we define heart attack?
So just like the brain, it's all about circulation. And anything that impedes that circulation is going to cause those tissues to die. So in your heart, we have some really big blood vessels. And typically what's happening there, they're not really, I hate to use the word exploding, but they're not, those blood vessels aren't, well, I guess they could just burst, but typically they're just being clogged.
Right.
And so it starts slowly. It's a little, it's a little clog. We put up another image up here, and you can see sort of that yellow plaque has built up. And so the red blood can't pass through. And it starts off little and it grows. So in the beginning, you might not, it just might be like, a little indigestion, right? And you rub your chest. Then the next time you have just a little sharp pain when you go to mow the lawn or bend over, and it goes away. Then the next time you're just sitting watching TV, you're not doing anything physical, and you feel it. Then the next time you feel it and it doesn't go away. And every time you do the same activity, it keeps coming back.
Yeah.
And then maybe now you're having other symptoms outside of just your chest.
Well, speaking of symptoms, let's go there. So what are some common signs and symptoms of a heart attack? Geraldine, come on.
Oh.
So if you're not watching, certainly come check us out on YouTube if you have time. We put up graphics just to help us, medicine, anatomy, physiology. It's complex for all of us. And so we put these images up here because we all learn different ways. And so we think it helps.
So yeah, some warning signs of that you are having a heart attack includes breaking out into a sudden cold sweat, having like that discomfort in your chest. Like Kimberly said, sometimes it can start off, initially it starts off pretty mild, and then sometimes it just intensifies and you're just having that pain at rest. Commonly, people also experience like extreme fatigue, tiredness, lightheadedness, dizziness, neck and jaw pain. And sometimes when you have the neck and jaw pain, you might not necessarily have chest pain, but that's also a very common sign, a warning sign. I mean, upper back pain, shortness of breath, where you're having trouble breathing, having that chest pressure, nausea, vomiting, and then feeling that heartburn and indigestion. Another symptom is experiencing like numbness or tingling like in your hands and feet. And I do want to point out that with women, sometimes their symptoms are different, and which sometimes makes it a little difficult when they're experiencing those symptoms, because they might not think that that's what they're having. And it's very, very important to know that women may have atypical symptoms, which means it's not like your common like chest pain and feeling like you're, someone sitting on your chest. They may have symptoms like where they have like brief or sharp pain that's felt in the neck, arm, or back. And then sometimes the first symptom unfortunately, first sign and symptom of heart attack for them is sudden cardiac arrest, which obviously is not ideal. So at that point, you need to perform CPR on that individual.
So yeah, we all worked on a cardiac unit. So we took care of a lot of cardiac patients. So just like the stroke, when you come into the emergency department and you tell them you have signs and symptoms that ring to us, like concerning of a heart attack, you're going to go to the top of the line. We're going to put some stickers on your chest, which we call the EKG, look at your heart rate and rhythm. And then depending on what that shows, will determine what unit you go to, what monitoring takes place, like the heart monitor or the telemetry, and then what kind of medications you need. We're going to check your vitals, look at your blood pressure, draw some blood, see how your other organs, because we need to identify what's causing that. And if we can do that through your blood work, we're going to do that.
And something that some things that we may offer you up front some treatments per se. A lot of times we're going to offer you some morphine for that pain. We may even put some oxygen on you, depending on if your oxygen is low. We may even offer you a medication called nitroglycerin. And that medication is going to help open up those blood vessels and let that blood flow. Because remember, the whole reason you're having a heart attack is because your blood vessel is blocked. So we want to open up that blood vessel and let the blood flow a little bit easier. And then we may also offer you some aspirin, which helps things be a little more slippery in there and let the plaque flow a little easier and the blood flow just even more easier. So it helps make things slippery. That's just what's way to describe that for me. It makes it slippery.
As you've noticed, there's a lot of acronyms in nursing and medicine, and this one is MONA.
Yes.
Morphine, oxygen, nitro, and aspirin.
You just took me back.
When people say, like we told you before, this can happen. You can have that little tingle in your chest. That may be for years.
Yeah.
Right. And so your doctor might give you that prescription for nitro, and they might have diagnosed you with angina or angina.
Yes.
There's some, depending on what part of the country you're in.
Right.
And so they might give you a little bottle, and you slip the little pill underneath your tongue. I mean, there's the pill, sublingual, there's the under the tongue, the swallow, the chest, the patch, and there's a spray.
Yeah.
Oh.
Yeah. And there's like rules on how you can't have it in certain temperatures and exposed to light.
Yeah.
So you might have that. And typically you can take, I should have double checked this. You can take one every 5 minutes, 3 times.
Yes.
Yeah. And then like once they drill it in you, it's
we know that.
And then at that point, after the third time, if you're still having pain, you have to call 911.
Yeah, so if it goes away after the first pill, good, keep going about your business. If it goes away after the second pill, keep going about your business, but maybe think about making some lifestyle changes. After the third time it hasn't gone away, you have to call 911.
Absolutely.
And in the hospital, we would give that in liquid form through your arm.
Yep. All right, Jody, and talk to us about some risk factors.
Yes. So just like stroke, for heart attack, there are also modifiable, which are things that we can control, and non-modifiable risk factors, which are things that are out of our control. As far as our non-modifiable risk factors, they include age, which for men age 45 years and older, and women that are age 55 years and older, they're more likely to have a heart attack than younger men and women. Not to say that young people cannot have heart attacks, but it is more common in that age group. Another non-modifiable risk factor would be having a family history of heart attacks. So if a first degree relative, such as a brother, sister, parent, or even grandparent, had an early heart attack by the age of 55 for males or 65 for females, you are at an increased risk for having one as well. So some of our more modifiable things include using tobacco. So like Alicia said, we're not going to tell you to limit your tobacco use. We tell you to limit other things, but that we want you to quit. If you're smoking, it is imperative that you quit. And also secondhand smoke is very, very important that you brought that up, because we don't think of secondhand smoke as being, affecting us, but it definitely does. Not only our like cardiovascular health, but it can also affect our respiratory system. Having high blood pressure and high cholesterol are also risk factors for having a heart attack. And being obese, lack of exercise, having diabetes, and then not following that healthy diet can increase your risk. And then stress, we don't think about it, but stress can definitely increase our risk for heart attack and stroke. And then illegal drug use. So that's not a common one that people think about, but if you're using cocaine, amphetamines, or any stimulants, they can trigger a coronary artery spasm that can cause a heart attack.
Yeah, and so in that image that we had up earlier, where it showed the blocked vessel with the heart, there was like an area that was shaded, and that tissue has essentially died, right? And so that's where the pain is coming from. And so all those medications that we've talked about will open that area up. And then you had just said something, and I was going to piggyback on that.
The illegal drugs?
Or
Stress?
No. Maybe it'll come back to me.
It's okay.
Yeah.
It happens to the best of us, right? So what can we do to prevent getting a heart attack? None of this may sound new to you, because it's very similar to what you can do to prevent yourself from having a stroke, right? So in case you didn't know, stroke and heart attack go hand in hand, right? So if you're at risk for a heart attack, you're probably also at risk for having a stroke.
Absolutely.
So following a healthy lifestyle, Don't smoke. I can't say it enough. Maintain a healthy weight with a healthy healthy diet. Get regular exercise and manage stress. You want to manage your other health conditions, high blood pressure, diabetes, and ask your healthcare provider. Ask your healthcare provider how often you need checkups. Take your medications as directed. Your healthcare provider may prescribe medications to protect and improve your heart health. And then if you're using illegal substances such as cocaine, amphetamines, all those good things, stop doing those. Stop doing those.
I remember. So
She remembered. I saw it on her face.
So in addition, like you come and you reported that you're having this chest pain, this tingling that won't go away, or it keeps coming back. So they might have you go to the cath lab,
Right.
and they might stick an instrument in there to evaluate the blockage. And typically they'll say, oh, it might be 50% blockage or 60%. And then depending on how severe it is and how many blood vessels are involved, they might refer you to the surgeon who will recommend a cabbage or
coronary artery
bypass.
Right?
Yes.
Yes. Come on,
we were just giving you guys a chance to fill in the blank. Yeah, and so that's going to open up all those vessels. It's an effective treatment.
Yeah.
But it's not a cure, because if you go back and continue to do all the same things, you're going to you end up coming back and needing more care. But it opens up those vessels and can reduce your risk of having a heart attack.
And I like that you brought up the cath lab, because not everyone needs a cabbage. A lot of times in the cath lab, when they go in to assess what's going on, depending on how, if it's not severe enough to require needing to go get a cabbage, they can automatically include put in a stent, which opens up the blocked area right then and there in the cath lab.
And that'll be information you share with your primary care provider next time they want to know about your medical history.
Yep.
And then that stent, you might need certain medications to prevent clotting, which we're going to talk about in a future episode.
Yes. That's going to be a whole nother topic. So for today, we're going to conclude that we helped define stroke and heart attack. We discussed the signs and symptoms of stroke and heart attack. We also discussed some risk factors in developing a stroke and having a heart attack. And then we discussed some preventative measures. And if there's one thing I need you to take away from today,
don't smoke.
Don't smoke. You got it.
So as always, you can email us your questions or show ideas to tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Please share the show with your friends and follow us on, or share the show with your friends and rate our Apple Podcasts and Spotify and leave a comment. It really helps us get more support and gets the message across to those who need it. And you can find our social media links and a list of resources related to our conversation today in the description box. We release a new show weekly on TMI Tuesdays at 10 a.m. on YouTube and on all of your favorite podcast apps. Follow, like, and share our content with all of your friends. Thank you for watching.
Thank you, everyone.
Bye.